My name is Violet Shivutse. I am the Global Chair for Huairou Commission. And I would also like to say that I am a caregiver, that's my background, and a leader of grassroots women caregivers from Kenya. My group in Kenya is called Shibuye Community Health Workers, which is a member of Huairou Commission, a global movement of grassroots women-led organizations. Hello, champions for gender equality and economic justice. I'm sad I could not join you in person today, but 3 weeks ago, I traveled from Kenya to New York at the invitation of the UN Deputy Secretary General for a high-level expert group meeting on care. She convened this meeting with the Executive Director of UN Women. I would like to share several important insights that were validated at this meeting. Number one, the critical role that grassroots women leaders played in providing care and support to their community and members during the pandemic and the lockdowns, just as African grassroots women groups had done throughout the HIV/AIDS pandemic, which I'm sure there's evidence that everyone has around this. The second one is, just as care provision spans nuclear families, non-traditional and self-community groups, it is also differs between Global South and North. Hence, it is important we reflect this diversity in our feminist care advocacy agenda. 3, scale up public investments in gender-responsive care and social protection systems as essential elements to boost recovery and transformation for a more crisis-resilient future. In the context of today's high-level interactive dialogue on innovation and technology change to advance the care agenda, I understand and appreciate that you discuss the potential for technology and innovation to increase the well-being of care workers and those they care for. However, this depends on investing in the organization of caregivers at all levels, grassroots women community groups, domestic workers and household, women-led parent and neighborhood associations who can champion their contributions and support they need to sustain. It is also requires the women's movement championing a gender-just care economy to consciously respect and put forward the constituencies of caregivers that are well known in cities, villages, in countries, and as the front line as advocates and gender framers. Governments, development and donor agencies, researchers, NGOs, and other professionals are key allies, but only as long as you walk by side with us, the organized caregiver providers. Nothing is for us without us. As a chair of Huairou Commission, a proud founding member of the Global Care Alliance, I want to appreciate the government of Mexico, UN women staffs supporting them for modeling an inclusive and strategic leadership and encouraging diverse feminist movement constituencies, locally and labor force, to cooperatively build a political momentum for gender-just caring societies and an economic system. And on this note, I would like to share a call for actions from the Global Care Alliance perspective. Number one, recognizing care and domestic work, community to household level, as a public good and work that is essential to the economic and social well-being. Number two, acknowledge the unpaid care burden shouldered by women and the negative impact it has on the realization of women's economic rights. 3, scale up public investments in gender response care, political protection systems, and as essential elements to boost recovery, transformation for a more crisis-resilient future. Number 4, create, invest, and implement care-sensitive recovery packages and comprehensive care systems that ensure access to care for people who need it and guarantee the rights of those who provide care. Support feminist movements in their diversity, grassroots labor, and women's organizations leading a just and care economy agenda. Thank you so much. Asante sana.
Violet, powerful speaker as you are. Oh my goodness, I really admire you, and I thank you. And then I'll ask Juan to please stop recording so we can